Hello, this is Ed, and thank you very much for watching NTalks for talks about nursing, academics, study skills, health and social care. For this video, let's talk about asthma. So, what is asthma? Asthma is an inflammation of the respiratory airway related to hypersensitivity of the smooth muscles, and this inflammation tends to be episodic, and asthma is a chronic condition. However, the condition is reversible. For a review on the respiratory system and how we breathe in air, so we breathe in air through our nose and our mouth, and it passes certain structures such as the trachea, the right and left bronchus, and then into the lungs. If there are certain triggers where the person or asthmatic person is hypersensitive into, such as dust, for example, then that would lead to inflammation of the airways, specifically in the bronchial areas, and this could lead to partial obstruction and in severe cases, full obstruction. Possible triggers that may be associated to asthma include things like infections, dust, animal hair. Sometimes an asthmatic attack may be associated to changes in temperature and as well as intense emotions. And we can also add in the possible triggers things like stress as well. One important thing to remember about these possible triggers is that for each asthmatic person, triggers may be different from each other, and some individuals with asthma may not be able to identify their possible triggers as well, because if they're able to identify the specific triggers, then it would be good to avoid exposure to these certain triggers. Signs and symptoms of asthma will depend on the severity. Some symptoms tend to be mild, some moderate, and then some severe. The most common symptom is wheezing, which is bilateral, and this is usually due to partial obstruction of the airway as a result of the inflammation. And how wheezing is described is that it's a high-pitched sound that is usually heard during inspiration. So because there's partial obstruction, wheezing sound can be appreciated, but when it comes to full closure of the airway, then no breath sounds can be heard, and this is considered as a medical emergency. Other signs and symptoms also would include tightness in chest accompanied by cough with sputum, an increasing respiratory distress in severe cases, and some asthmatic individuals would also present with some atopic conditions such as eczema and food allergies. How asthma is determined usually depends. Some countries will have their own specific and applicable guidelines on how physicians or doctors will diagnose asthma. In general, the doctor may diagnose or determine that asthma is present based on clinical assessment of the signs and symptoms, and they may also conduct tests such as the FeNO test or the fractional exhaled nitric oxide test. This test detects nitric oxide levels in breath, which may indicate that an inflammation is going on. And they may also conduct tests such as spirometry and peak flow studies. The management of asthma is very, very individualized, and patients with asthma are usually taught to manage mild symptoms by avoiding the identified triggers and taking the prescribed medications and carrying the prescribed inhalers so that when an attack happens, which can be anytime, a bronchodilator can then be administered. The goal really for the management of asthma should be in preventing further attacks and exacerbations. The following are the possible medications that may be prescribed by doctors for patients with asthma. Most common medication for bronchoconstriction episodes are the beta-2 agonists such as salbutamol or beta-2 agonist. They mimic the effects of the sympathetic nervous system activation, and this promotes the release of adrenaline, causing bronchodilation. Other medications would include the acetylcholine antagonists such as the ipratropium bromide, and medications also would be those of the inhaled corticosteroids such as beclomethasone. One thing about this, because since it's steroid therapy, they are used in the short term due to steroid side effects such as an increase in the susceptibility to infections. Other medications that may be prescribed would be leukotriene receptor antagonist, in which an example is montelukast. And leukotrienes are inflammatory molecules produced by the immune system. Leukotriene receptor antagonists, these medications, they inhibit the synthesis of leukotrienes, thus having an aim of preventing inflammatory episodes. In hospital settings, they may administer some medications such as aminophylline. However, this bronchodilator, this aminophylline, it has a narrow therapeutic range, and because of that, the clinician must monitor the levels closely when aminophylline is administered, because we want to avoid the incidence of drug toxicity because of this narrow therapeutic range. And in severe cases, the adrenaline or epinephrine may be administered to patients with asthma, and this may be given via the intravenous route. Some asthmatic episodes, like severe asthmatic episodes, they don't respond to certain treatments, and we have a term for this called status asthmaticus. It's such an old term, and this may not be a term that's used. Sometimes they just use the term acute severe asthma instead of status asthmaticus. Oxygen therapy may be required for respiratory symptoms that present with low oxygen levels. The management of an asthmatic attack is aimed at relieving patients with their symptoms and keeping them comfortable. So that's usually the main goal, and once stable, the goal should then be in preventing further attacks and exacerbations in the future as possible. So there you have it. That's asthma in a nutshell. Again, thank you very much for watching NTalks, and please subscribe to this channel for more videos.